Becoming a mother is one of the most beautiful and yet the most tiring journey a woman can go through. It is physically, emotionally, as well as mentally demanding. The mental health issues can occur because of the physical exertion, the stress that the body undergoes. It can happen because of the social aspects of life, because it changes a lot once you have a baby. And it can happen because of biological changes, which is the hormonal imbalance a woman goes through because of pregnancy. Some of the common manifestations of mental health issues in pregnancy and postpartum are postpartum blues, postpartum depression, and anxiety. If it becomes severe, and in rare cases, it can also lead to postpartum psychosis. Early recognition, finding out the signs, and being able to realize that you are facing some issues is the best thing to do for yourself, because realizing it early and doing something about it leads to prevention, or at least minimizing the impact of mental health issues on yourself and your baby too. The physical exertion, because of breastfeeding, you have to wake up throughout the night, the insomnia, sleeplessness itself is enough to cause major postpartum blues. It is a common myth that once a person becomes pregnant or once a person becomes a mother, they will not have mental health issues. Whereas the studies say as much as 20% of new mothers undergo some sort of a mental health issue in their pregnancy and in the early postpartum period. Some of the signs of mental health issues could be irritability, feeling angry and feeling so irritable that without any trigger and sometimes with minor triggers you react. It could be a feeling of hopelessness, worthlessness, feeling of not being enough or not being a good mother. The feeling of not being able to control your emotions and crying excessively. It could be changes in appetite. It could be changes in the physical sensation as well. Sometimes people complain of severe backache and sometimes body ache, which could also be because of the stress. It is important to understand that if you are having any of these symptoms or any negative emotions or negative thoughts, or overthinking a lot, these could all be early signs of postpartum anxiety or depression or postpartum blues. It is important that you realize that this is not you and this is not normal and this is not going to continue, and you seek help as soon as possible. When we talk about treatment of mental health issues, there are two aspects. Of course, the preferred modality is therapy, which is counseling, in which we talk about the issues, all the biopsychosocial model, where we take care of the biological issues which are happening, your own thought patterns and the negative thought patterns that are happening, and of course the social issues where it might be some issues with the family members, or there are some interpersonal relationship with the partner that might be contributing to this stress. We take care of all of that via therapy, commonly called as counseling. In severe cases where the symptoms are very physical and are impacting your day-to-day life and it is interfering with taking care of your baby, sometimes we consider medications as well. But of course, if you are pregnant or if you are a new mother and a breastfeeding mother, the medications are avoided. If at all medications are prescribed, the perinatal mental health experts make sure that the medications that are being prescribed do not come through breast milk and do not go to the baby. Today, we have a lot of medications that have that efficacy and can help you overcome the stress and anxiety and depression much faster. Nothing is worth suffering the trauma. So if you are somebody who is going through something major in your life and you can feel that you are not the same self anymore and you are finding it difficult to cope up, make sure that you consult a mental health professional in one way or the other. It's okay if you are not ready for the medication or starting therapy. Get an opinion, see what your options are, and then make an informed choice.
While pregnancy is one of the most memorable experience of a female's life, it definitely is also one of the most stressful things a female body goes through, both mentally and physically. So, once we have delivered the child, it is of utmost importance that a female is fit both mentally and physically so that she can give proper care to the child and can take care of herself as well. Few common complaints that a female generally comes with in her postpartum period include tiredness and generalized weakness, which is somewhat attributed to the change in the sleep cycle that you get just after delivering the child. And also, it is related to the increased requirements that your body has now that you are feeding a child. So, it is very important that you keep your diet in check and you keep your calorie intake in check and take proper supplements so that it helps in strengthening your body and getting back into the pre-pregnancy state. One of the other common things that they experience is lower back aches, which most of the times are due to faulty postures. It is very important to maintain a proper posture while feeding the child because this is something that you'll be doing for long hours, at least initially for few months, and also keep the levels of vitamin D in check, and if they are low, take proper supplements for it and keep on continuing it till the time you're feeding the child at least. One of the other common complaints experienced by females who have undergone vaginal delivery is that they get complaints of urinary incontinence. Why this happens is because the muscles of the pelvic floor get weakened. As a result, there is incontinence of urination. So, to regain that strength of the muscle, it is important to do regular exercise of those muscles, which is called as Kegel exercise. You can easily Google it. It is very simple to do, and just by practicing it daily, the strength of the muscles will come back gradually, and this complaint will get sorted to most of the extent. Whether it is a C-section delivery or it is a vaginal delivery, chances are that you get a stitch in vaginal delivery as well. So it is very important to take care of the scars that you get because of the operation, and it should not get infected. So maintain proper hygiene, keep the area dry, and if at all you feel any redness or swelling there, immediately go and take help. And if you have undergone vaginal delivery, it is all the more important because you'll be having vaginal discharge for a few weeks ahead. It is very important that you maintain proper hygiene in that area, and whenever you're washing the belly inner area, wash it from front to back so that the bacteria from the anal region do not enter the